Hello guys, today we'll talk about diabetes mellitus type 1 and type 2. Before we explain what happened exactly in case of type 1 and type 2 diabetes mellitus, we just explain briefly what happened in normal physiological body and cells. So that is a simple image of stomach, intestine and the blood vessels, pancreas here and the body cell. So when the sugar is coming inside the stomach, then the intestine, sugar will be absorbed inside the circulation, inside the blood vessels. So when the sugar go inside the blood vessels, and then when it reach pancreas, it will stimulate pancreas, and there is a special cells in the pancreas which called Langerhans cell. So when it's reached there and stimulate pancreas, and these cells will produce insulin. That's here is insulin, and it's sugar here in the circulation. So sugar will stimulate the cells in the pancreas, and these cells produce insulin. Then insulin will go beside the sugar in the body. Here, insulin will they reach both of them, when they reach the cells in the body, insulin will stimulate the receptors which is located on the wall of the cells. When it will stimulate the receptors and push sugar inside the cells. So here is insulin and attached to the receptors and push sugar inside the cells. Insulin attached to the receptors and push sugar inside the cells. So that what happened in case of normal physiological body and systems and cells. So now we will explain what happened in case of type 1 diabetes mellitus. So now I will talk about type 1 diabetes mellitus. So same image, it's stomach and intestine, blood vessels and pancreas. So when the sugar comes inside the stomach, then the intestine will get absorbed inside the vessels. So that's the sugars. When sugar at the type 1 diabetes mellitus, when sugar reach pancreas and stimulate the receptors of the Langerhans cells to produce insulin, at type 1 diabetes mellitus unfortunately not produced because Langerhans cell has been damaged. There is no secretion of insulin inside the blood vessels. So sugar will go to the cells, body cell, inside the circulation, the body cells, so can't enter inside the cell. Can't enter inside the cell of the body because there is no insulin. So sugar will accumulate here inside the circulation, and that's called hyperglycemia or type 1 diabetes mellitus. That's what happened exactly in case of type 1 diabetes mellitus. The Langerhans cell has been damaged by autoimmune, so the Langerhans cell can't secrete insulin inside the circulation. So now we will explain what happened in case of type 2 diabetes mellitus. In case of diabetes mellitus type 2, then again we'll explain stomach, sugar will in the stomach and in the intestine, and sugar will go to the circulation. Again we'll go to the pancreas and stimulate Langerhans cell. Langerhans cell type 2 diabetes mellitus produce insulin. So that's insulin inside the circulation will go beside the sugar to the body cells. So when insulin and sugar reach to the cells, insulin stimulate the receptors to push sugar inside, but unfortunately that not happen because the receptors, there is resistance. That's called resistance. resistance to the insulin. The receptors, it's resistant to the insulin. There is resistance to the insulin, so insulin can't push sugar inside the cells. Again, it's receptors of the insulin. Insulin want to attach to the cells receptors, but they can't. So there is resistance between the receptors of the cell and the insulin can't push sugar inside the cells. Then again will be here hyperglycemia. A lot of amount of sugar in the circulation, that's called hyperglycemia or type 2 diabetes mellitus. Diabetes mellitus type 2. So in case of type 1 diabetes mellitus, there is no secretion of insulin from the Langerhans cell in the pancreas, and in case of type 2 diabetes mellitus, there is resistance between insulin and the receptors of the cell. Type 1, there is no secretion of the insulin, and type 2, there is resistance between insulin and the receptors on the wall of the cells of the body. Both of them. That's what happened in case of type 1 and type 2 diabetes mellitus. Please subscribe to get all videos, easy explanation, quickly understanding.